Hi, I'm a secret scientist, and today we're going to be talking about this inflammatory condition called ankylosing spondylitis, and sometimes it's called axial spondyloarthritis. By the end of this video, you should be able to understand exactly what the disease is, including the causes of the disease and the treatments for the disease. If you've got any comments throughout, then just drop them in the box below, and I'll make sure to answer them. Let's get into it. Now, this condition is really interesting. If you go down the street and ask people if they've ever heard of ankylosing spondylitis, 91% of people will say no. And when you tell them it's a form of arthritis, they will immediately assume that it affects the elderly. But what if I was to tell you that any person in this video right now may have ankylosing spondylitis? Because the symptoms typically first occur when people are in their 20s or 30s. It's called an invisible condition because when people have a good day with the condition, you'll have no idea that they've even got ankylosing spondylitis. But on a bad day, the condition is associated with significant pain and fatigue. So, what on earth is it? Well, it's a painful progressive inflammatory arthritis of the axial skeleton. So, that's typically the neck, the ribs, the spine, and the pelvis. And it includes both ankylosing spondylitis, which is more common in men, and axial spondyloarthritis, which is more common in women. Now, ankylosing spondylitis is where you get these radiographic changes on a scan, so an x ray, for example, and you can see the spine fusing together, or you can see inflammation on the scan. Axial spondyloarthritis is where you don't get these structural changes to the spine or the skeleton, but they've still got significant inflammation causing harm around the body. Now, both of these are collectively called AxSpA, but the important thing is, advanced stage of the disease is associated with the breakdown of existing bone and the formation of new bone, particularly at joints. So if you think about the spine, for example, the spine should be able to bend to facilitate movement, but in advanced forms of ankylosing spondylitis, the vertebrae actually fuses together at points, which makes those areas immobile to be able to bend and flex with human movement. But it's not just about flexibility. The inflammatory profile underpinning this disease actually increases the risk of other things. So, for example, the risk of heart attacks is about 52% higher in people with this condition compared to the general population, and strokes 21% higher. Anxiety and depression are 600% higher in this population compared to the general population. And the inflammatory profile is associated with other diseases underpinned by inflammation, such as diabetes, uveitis, which is inflammation of the eye, high blood pressure, etc. And there's also substantial societal costs. So many people with the disease will work part-time because of the pain and fatigue, which results in loss of earnings. And it's been calculated that the annual cost of the individual is around £9,000 through lost earnings, going to hospital appointments, etc. And the annual drug cost per individual is about £8,300. Now, the surprising thing is, earlier on I said 91% of people have never heard of the condition, but it actually affects around 1% of the general population. And actually, the prevalence is double that of both Parkinson's and multiple sclerosis combined. And actually, most people have heard of those diseases. It's also thought that the number of people with AxSpA may actually be much higher than 1%, because normally what happens is people go to the GP with symptoms in their 20s, 30s, and 40s, and it often gets misdiagnosed as something like work stress, a slipped disc, etc. And that results in an average delay of diagnosis of 8.5 years, which is absolutely massive. But this is nothing against GPs, because the diagnosis of AxSpA is incredibly difficult. Now, the first set of diagnostic criteria is based on symptoms. So this is chronic back pain for longer than 3 months with a gradual onset, morning stiffness lasting over 30 minutes, it improves with activity and worsens with rest, it often awakens the patient from sleep overnight, and they get a good response to anti-inflammatory drugs, with over 50% of relief in symptoms in the first 48 hours. But what you'll notice is loads of these symptoms aren't specific to AxSpA, and it could be from a slip disc, etc. So that's why it's so difficult based on this diagnostic criteria. There are also these two markers in the blood that you can test for that indicate if AxSpA is present, and these are called HLA-B27 and levels of CRP, or C-reactive protein. Now, around 90% of people with AxSpA are HLA-B27 positive, but it's only associated with AxSpA, it's not causal, because actually if you look at the general population, only 2% of people with HLA-B27 have AxSpA, and if it was causal, then everybody with AxSpA would be HLA-B27 positive. And we know that CRP is a marker of inflammation, but actually it's not that good in people with AxSpA, because 40% of patients with AxSpA don't even have elevated CRP in the first place. Now, another way of diagnosing AxSpA is to look at imaging, and what you're looking for here is inflammation or fusion of a joint, especially at the SI joint, so the sacroiliac joint, but you can also see it on the vertebrae of the spine as well. However, what we know is that it can take up to 10 years for inflammation of the SI joint to show, and in some people, they never actually have radiographic changes. So based on this, you can understand why it takes around 8.5 years on average to get a diagnosis of AxSpA, because when you look at the symptoms, the blood tests, and the imaging techniques, what shows for one person might not show for another person, which makes it incredibly difficult to diagnose the disease. There are three theories about how axial spondyloarthritis begins, and the first is about HLA-B27, which is a protein found on the surface of certain immune cells. Its job is to present pieces of proteins to the immune system, helping the immune system recognize and respond to these harmful pathogens. But in axial spondyloarthritis, HLA-B27 mistakenly presents proteins from their own body's tissues, and this confuses the immune system, which sees these proteins as threats and starts attacking them. This process targets the body's own tissues and joints, leading to inflammation and damage, and this is what we call an autoimmune disease. The second theory is about the role of the gut. Now, gut inflammation can weaken the intestinal lining, causing what's known as a leaky gut. This allows the harmful bacteria and bacterial toxins to escape into the bloodstream, and once in the bloodstream, these bacteria can travel to distant areas like the joints, where they trigger an immune response, leading to inflammation. The third theory, which is the one which I probably least agree with, is about mechanical trauma at the bone attachment site, which can trigger the recruitment of immune cells to the area. This activates the immune system, leading to localized inflammation and pain at areas such as the joints. The immune system plays a central role in AxSpA, particularly through CD4 and CD8 T cells. These are immune cells that normally help fight infections. However, in AxSpA, these cells are overreactive and release cytokines, which are chemical messengers that drive inflammation. The CD4 and the CD8 T cells release pro-inflammatory cytokines such as TNF alpha and IL-17 at sites like the spine and the joints. And this excessive inflammation leads to bone erosion, where the body breaks down bone tissue, causing damage and pain. At the same time, the inflammation also triggers processes that lead to abnormal bone formation, and this results in bone spurs and fusions, which reduce mobility and cause stiffness in the joints. This combination of bone destruction and abnormal repair is the hallmark of AxSpA, which makes these T cells and their cytokines key targets for treatments like your medications. Now, as mentioned earlier, not everybody has joint fusion. However, these cytokines can also sensitize pain receptors, leading to increased pain even from minor movement or pressure. These cytokines can also influence the brain areas which regulate energy, mood, and sleep. So high levels of these cytokines can lead to fatigue, brain fog, and even depressive symptoms. And the reason so many people with AxSpA suffer with fatigue is because high levels of these cytokines can also impact cell function, which reduces the ability to produce energy efficiently. So what exactly are the treatments or management of AxSpA? Well, the first line of therapy should be physical activity. So this is stretching the joints, low load bearing exercises such as walking and swimming, and low resistance exercise just to strengthen the joints. And importantly, you should be able to listen to the body. So if there's excessive pain, scale back the exercises. And then when you feel ready to increase the intensity, then go for it. Now, it's known that physical activity by itself can reduce inflammation, but with AxSpA, it should be supplemented with these non-steroidal anti-inflammatory drugs, which aim to reduce inflammation and pain so that the individual is able to become physically active and sustain that. However, these drugs are only effective in around 20% of patients. If the first line of therapy is ineffective, then people are progressed onto these biologic medications which stop the immune cells from producing these pro-inflammatory cytokines. If the biologics aren't effective, then people can be progressed onto these JAK inhibitors that work by calming down the overreactive immune system and blocking signals that cause inflammation in the body. Now, the biologics and the JAK inhibitors are quite expensive, and actually many people have to switch the medications as the effect of one medication wears off. Now, the good news is there's a whole host of research going into what causes AxSpA and the best ways to manage it. But at the moment, there's no definitive cure for the disease. So what we know so far about AxSpA is that it's an inflammatory arthritis that usually first appears in the 20s and 30s. It's associated with significant pain and fatigue, and the inflammation can increase the risk of other diseases. It's initiated via the immune system, the gut, and/or this mechanical trauma, And so far, there's only these management guidelines in order to manage the disease, but there's no definitive cure for it. If you found this video useful, then please show your support by subscribing to the channel. I'm a scientist by trade and will be doing regular videos on scientific topics that you'll find interesting. And if you've got anything that you want me to cover, then please leave it in the comment box below and I'll do my best to cover it.